Now, coming on to the problems that are associated. This often comes as a short note and is very important to actually note as well. So, for dental, I want you to remember an acronym as TETS. I don't know if you want to pronounce it that any other way. So, T stands for tooth anagenesis, hypodontia. E stands for enamel hypoplasia. Again, E stands for ectopic eruption transposition. C stands for crossbite. T stands for taurodontism. What is taurodontism? It is the crown appears to be bulky, so they appear like bull shaped. What is dilaceration? Dilaceration was when there is a the root is hooked like in a form of hook. Okay, and S it stands for supernumerary teeth. Now for skeletal, you can remember CCMM, Chief Minister. So class 3 malocclusion, then concave profile. This is very important. This. Then maxillary deficiency, mandibular prognathism. Okay. Now coming on to the feeding problems. For feeding problems, I want you to remember the acronym as body, but with an I, not with a Y. So B stands for bottle, cup, spoon feeding. Then O stands for oronasal fistulas. D stands for draining of oral fluid in nasal cavity. Infant held at 30 to 45-degree position to aid swallowing. In hearing problems, acute, chronic otitis media. Speech problems, they are unable to make the consonant sounds. Uh, Important thing to remember is these speech problems can be corrected by a procedure called as highness pharyngoplasty. This is often asked. So consonant sounds like B, P, D, K, T. Then there is a nasal and hypernasal tone to voice. Now coming on to orthogonathic. In orthogonathic, what we see is we see mid-face deformity. The maxilla is horizontally and vertically underdeveloped. Now, this can be corrected by maxillary osteotomy, which is performed at 18 years of age. Now, associated syndromes Down syndrome, Pierre Robinson syndrome, Treacher Collins syndrome, van der Waals Edwards syndrome. Now, this is an extra part you can remember if you want to. So, in this is the Philadelphia Center for Research in Child Growth. There's a person named as Wilton Krogman. He divided the treatment into basically 8 stages, okay, based on the age. So, first stage, second, third, fourth, fifth, sixth, seventh, and eighth. Now, this is prenatal. This is at birth to first year, first 2 years, 2 to 6 years, 6 to 12, 12 to 18, and 12 years after. Okay, now prenatal may what happens is counseling is done. Okay, and complete history is taken, gestation history, maternal history. At birth what happens is the surgeons, they fabricate the operative plan. The pediatrician, they discuss the condition with the patient, and the dental specialist, what they do is they take the arch relations. Okay, now in first year the patient is advised about feeding by the pediatrician. The speech is also seen. There can be insufficiency and incompetence of the pharyngeal seal, which will be discussed. Then the surgeon, he can perform lip closure. Now this is very important. We'll discuss about it later. Now 1 to 2 years, there is health and nutrition. If there is prosthetics, then the vocabulary. Also, we have to monitor the ear condition because we just considered that in problems there can be acute and chronic otitis media. For 2 to 6 years, orthodontic treatment, and in 6 to 12, we can have surgical correction of the palate, the lip, and the nose. In 12 to 18, the orthodontic treatment will continue and there will be surgical follow ups. Now, after 12, there should be regular follow ups. Now, coming on to the cleft lip repair. Now we'll discuss the technique. Now in technique, first of all, there is a Milliard's rule of 10. So in Milliard's rule of 10, hemoglobin should be more than 10 gram percent, age should be more than 10 weeks, weight should be more than 10 pounds, and the total cells should be 10,000, more less than 2,000 cells millimeter cube. Now unilateral cleft lip is repaired by Milliard's rotation advancement flap, also by Tennyson's Randall triangular flap method, bilateral by single stage by View's third method, also in 2 stages also with a 3 to 6 month interval. Now in this what we do is we have this condition. All right. Now what we do is, first of all, markings are made. Then adrenaline 1 is to 2000 ratio is injected in the labial sulcus for hemostasis. Then full thickness of the lip is incised according to the marking. Then the lip repair is done in 3 layers MMS. So mucosa, muscle and skin. Then for aesthetic results, the cupid bow must be retained or must be horizontal, white line of continuity, and there should be no vermilion notching. Now coming on to the cleft palate repair. Now cleft palate repair can be done in 1 to 1.5 years. Now there are certain types. First of all, you just need to remember the names. Mucoperiosteal flap. They are raised by certain techniques: VY, pushback, palatoplasty. To remember this, you can remember acronym TVD, the Vampire Diaries. Okay, so V, just remember V comes 2 times. One leg in back, 3 double flap technique. By D, remember double revising Z plasty. In this also, first of all, palate will be infiltrated, okay, with adrenaline and saline. Then 2 mucoperiosteal flaps are elevated, nasal layers in nasal, mucosal and oral. 3 layers. Lip was 3 layers, MMS, mucosa, muscle and skin. Then the palatal lengthening is achieved by BY plasty and all. So this completes cleft palate and cleft lip.